Question 1. As a professional, a nurse can do research for varied reasons except A. Professional advancement through research participation. B. To validate results of new nursing modalities. C. For financial gains. D. To improve nursing care. Question 1 answer. C. For financial gains. Question 2. Each nurse participant was asked to identify a problem. After the identification of the research problem, which of the following should be done? A. Methodology. B. Review of related literature. C. Acknowledgement. D. Formulate hypothesis. Question 2 answer. B. Review of related literature. Question 3. Which of the following communicate the results of the research to the readers? They facilitate the description of the data. A. Hypothesis. B. Statistics. C. Research problem. D. Tables and graphs. Question 3 answer. D. Tables and graphs. Question 4. In quantitative data, which of the following is described as the distance in the scoring units of the variable from the highest to the lower? A. Frequency. B. Mean. C. Median. D. Range. Question 4 answer. D. Range. Question 5. This expresses the variability of the data in reference to the mean. It provides us with a numerical estimate of how far, on the average, the separate observations are from the mean. A. Mode. B. Standard deviation. C. Median. D. Frequency. Question 5 answer. B. Standard deviation. Question 6. According to the WHO statistics on the homeless population around the world, which of the following groups of people in the world disproportionately represents the homeless population? A. Hispanics. B. Asians. C. African Americans. D. Caucasians. Question 6 answer. B. Asians. Question 7. All but one of the following is not a measure of central tendency. A. Mode. B. Variance. C. Standard deviation. D. Range. Question 7 answer. B. Variance. Question 8. In an array of 88, 81, 89, 88, 90, 92, 90, what is the mean? A. 88.3. B. 88.4. C. 88.1. D. 88.2. Question 8 answer. 88.3. Question 9. In the value 80, 80, 80, 82, 82, 90, 90,100, 90. What is the mode? A. 80. B. 82. C. 90. D. 85. Question 9 answer. D. 85. Question 10. In the value 80, 80, 10, 10, 25, 65, 100, 200, what is the median? A. 71.25. B. 22.5. C. 10 and 25. D. 72.5. Question 10 answer. D. 72.5. Question 11. Draw lots. Lottery. Table of random numbers or a sampling that ensures that each element of the population has an equal and independent chance of being chosen is called A. Cluster. B. Simple. C. Stratified. D. Systematic. Question 11 answer. B. Simple. Question 12. A researcher wants to determine some of the problems that are experienced by diabetic clients when using an insulin pump. The investigation went into a clinic where he personally knows several diabetic clients having problem with insulin pump. The type of sampling done by the investigator is called A. Probability. B. Purposive. C. Snowball. D. Incidental. Question 12 answer. B. Purposive. Question 13. If the researcher implemented a new structured counseling program with a randomized group of subject and a routine counseling program with another randomized group of subject, the research is utilizing which design? A. Quasi-experimental. B. Experimental. C. Comparative. D. Methodological. Question 13. Answer: B. Experimental. Question 14. Which of the following is not true about a pure experimental research? A. There is a control group. B. There is an experimental group. C. Selection of subjects in the control group is randomized. D. There is a careful selection of subjects in the experimental group. Question 14. Answer: D. There is a careful selection of subjects in the experimental group. Question 15. The researcher implemented a medication regimen using a new type of combination of drugs to manic patients while another group of manic patients receives the routine drugs. The researcher, however, handpicked the experimental group, for they are the clients with multiple episodes of bipolar disorder. The researcher utilized which research design? A. Quasi-experimental. B. Pure experimental. C. Phenomenological. D. Longitudinal. Question 15. Answer: A quasi-experimental. Question 16. You are interested to study the effects of medication and tactile stimulation on the pain experienced by the cancer patients. What type of variable is pain? A. Dependent. B. X variable. C. Independent. D. Interdependent. Question 16. Answer: A dependent. Question 17. You would like to compare the support system of patient with chronic illness to those with acute illness. How will you best state your problem? A. A descriptive study to compare the support system of patients with chronic illness and those with acute illness in terms of a demographic data and knowledge. B. The effects of the types of support system of patients with chronic illness and those with acute illness. C. A comparative analysis of the support system of patients with chronic illness and those with acute illness. D. A study to compare the support system of patients with chronic illness and those with acute illness. E. What are the differences of the support system being received by patient with chronic illness and patients with acute illness? Question 17. Answer: C. A comparative analysis of the support system of patients with chronic illness and those with acute illness. Question 18. You would like to compare the support system of patients with chronic illness to those with acute illness. Considering that the hypothesis was, clients with chronic illness have lesser support system than clients with acute illness. What type of research is this? A. Descriptive. B. Experimental. C. Correlational, non-experimental. D. Quasi-experimental. Question 18. Answer: A descriptive. Question 19. In any research study where individual persons are involved, it is important that an informed consent of the study is obtained. The following are essential information about the consent that you should disclose to the prospective subject except: A. Consent to incomplete. B. Description of benefits, risks and discomforts. C. Explaining of procedure. D. Assurance of anonymity and confidentiality. Question 19. Answer: A consent to incomplete. Question 20. In the hypothesis, the utilization of technology in teaching improves the retention and attention of the nursing students. Which is the dependent variable? A. Utilization of technology. B. Improvement in the retention and attention. C. Nursing students. D. Teaching. Question 20. Answer: C. Nursing students.